Hello, I'm Dr. John Harding. I'd like to welcome you to this 7th program in our Parent Education series, Raising Children with God's Help. We're going to do immunizations in the first year, this program. It's not easy to be an infant these days. There are a lot of immunizations to be received. We call them immunizations because that's a kinder word to say than shots, but I think all of the kids that come in, especially as they get older, think of them as shots rather than immunizations. The babies now start with an immunization right before they leave the nursery. There's a new Hepatitis B vaccine that will be given within the first 12 hours of life. This is to protect them against the virus, which can affect their liver, and it will be preventative. And the hope is to eradicate this disease from society by starting with immunizing the infant. The word immunization means to protect against a disease. The immunizations, some of them are to prevent bacterial infections, some of them are to prevent viral infections. The way the immunizations work is they really fool the body into thinking that the infant's body has the disease, and the body starts to fight it and produce antibodies which would eliminate the disease if it were there. The bacteria that are used are killed bacteria, so they're not able to cause the actual bacterial disease. The viruses are attenuated, they're weakened, they're reduced to a state where they can't actually produce disease, but they can fool the body into thinking that the disease is present, and the body makes antibodies against it. The Hepatitis B vaccine will be the first given. It's going to be given in the first 12 hours of life before the baby leaves the nursery. Then the baby goes home, and usually the first official visit in the pediatrician or the primary caregiver's office will be at 1 month of age. At this time, we probably will be given the Hepatitis B vaccine for the second time. It can be given 1 or 2 months after birth, but at 2 months, we will be giving 2 immunizations, 2 shots, and a polio drink, so it'll probably make more sense to give it at the 1-month visit. The injections are given into muscle. They usually, in my experience, half of the time don't seem to cause anything. They don't seem to cause any systemic generalized reaction or even a localized reaction. But about half the time, I think most of the immunizations will cause some local reaction. You'll see a little swelling, you'll see a little redness. I think the infants have a sore muscle, probably much like we would feel if we sustained a Charlie horse, a sports injury, where the muscle is sore and tender, maybe a little bit of swelling. The 2-month-old visit, we give a DPT, a polio, an oral polio drink, and an HIB. Now the DPT immunization, these letters stand for D is diphtheria, P is for whooping cough. The name of the bacteria that causes whooping cough is pertussis, and that's why we have the P. And T is for tetanus. This immunization is such a great benefit to the infant to prevent these diseases. I haven't seen a case of diphtheria. I've been practicing 23 years and 4 or 5 years training before that. I've never actually seen a real case of diphtheria in an infant. I've read about it, and I realize it's a very serious disease. It can be life-threatening, and it could kill an infant, but it really is prevented if the babies get their diphtheria injection as a part of the DPT. The P part, the whooping cough, I've seen in medical school cases of whooping cough. I've continued to see them in practice. They seem to be much milder now, although if they're not immunized at all, they certainly can get a life-threatening illness with whooping cough. When I was in medical school, I saw infants with whooping cough, and they were so seriously ill. They would be 6 to 8 weeks in hospital. Some of them would have pneumonia. They would have fits of coughing where they'd turn blue and choke and had real difficulty catching their breath, and sometimes were unable to eat because of the frequency and the sustained episodes of coughing. Now I think if we saw an infant that had an unusual cough, a very persistent cough, a cough that really seemed to be giving them a lot of trouble, we would still think of whooping cough, although if they'd had their immunizations in their series, it would be much less likely. The tetanus, again, I have not seen a case of tetanus in infancy or childhood in the past 23 years in my practice. I did see a case in medical school. They certainly do occur. In this country now, there will be cases of tetanus reported. Again, there's a lot of not keeping up with immunizations. In some parts of the country, immunizations aren't given as well as they are here in Massachusetts. And a lot of times, as we get into young adult or middle age, we don't keep up our immunizations. Tetanus has to be given every 10 years to keep an immunity to tetanus. And diphtheria the same. The HIV is a relatively new vaccine. It's a very, very serious bacterial infection, particularly in early infancy. It's the commonest cause of bacterial meningitis in early infancy. The vaccine has been used now for several years, and it is effective, and it's going to be a great boon. It'll be very, very good to see the statistics over the first 10 years of use in terms of reducing the bacterial meningitis caused by this particular bacteria. The HIB stands for Haemophilus influenza bacterium, and it's type B. At 4 months, this same trio of immunizations is repeated, the DPT, the oral polio, and the HIB. The oral polio is the vaccine that we give in this country. It's the preferred vaccine. It's very effective. Again, I haven't seen a case of polio in my practice in the past 23 years, but there was an epidemic of polio in the early 50s. I did see cases of polio in medical school. I did see young people in iron lungs, totally paralyzed from the neck down, unable to breathe for themselves, and it was a very, very sad disease. And it's so great to be able to prevent all of these diseases. They're all life-threatening. The hepatitis B, the diphtheria, whooping cough, tetanus, polio, the Haemophilus influenza, bacterial meningitis, they're all life-threatening or can be seriously damaging. And it's a great thing to be able to prevent them. Unfortunately, we don't live in a perfect world, and like everything else, none of these immunizations are perfect. They don't perfectly prevent the disease. The range of protection will sometimes range from 70 to 95% effective. There are rare side effects, sometimes 1 in 10,000, 1 in a million. But there are side effects. Sometimes they cause high fevers, and sometimes this can lead in a small infant to a seizure. But infants in the first year or two of life can have seizures from fever, from ordinary virus colds that shoot up a high fever. These fevers and these seizures are not damaging. They're frightening, but they're not permanently damaging. The local reactions are the most common to all of these immunizations that are given by injection into the muscle. The commonest thing that we'll see will be some local swelling, some local redness, some local tenderness. There sometimes is a low-grade fever, 101, even up to 102, but this degree of fever is usually well handled by the infant. And as soon as we see a fever beginning, we'll take appropriate measures. We'll give acetaminophen, an appropriate dose for age and weight. Acetaminophen is what you know as Tylenol or Tempra, Liquipren. We'll put, I usually recommend if there's local swelling and redness and discomfort, immediately within the first several hours, I think a cold compress, chipping up ice and putting in a wet face cloth putting that on for 5 or 10 minutes at a time. That'll reduce the swelling and take away some of the soreness. I think after the first several to 12 hours, I think heat, local heat, will relieve. I think, again, the muscle is sore. It's maybe in a cramp. It's like a Charlie horse. I think putting an infant in a warm bath, letting them soak, and I think that will relax the muscle and relieve some of the discomfort. The 6-month immunizations that we give are the DPT and the HIB. The series now, the initial series, the series of 3, the 2, 4, 6-month series is now complete. And the infants do have good immunity now. They do have good protection to these diseases. The second hepatitis B vaccine is to be given between 6 and 18 months. I will probably give this vaccine at about 9 months. This is a regular appointment in the office in the first year of life. There are no other immunizations to be given at this time. It seems like an awful dose to me to even think of giving 2 immunizations, 2 injections at one visit, and I think 3 would be just too much, and I would definitely give it at a time when there were only 1 or no immunizations. The 18-month visit, and I'm going a bit beyond the first year now. The next immunization, sorry, will be at 15 months. And this is the measles, mumps, and German measles, and that's the MMR. The R stands for rubella, which is the name for German measles. I saw all of these virus diseases while I was in medical school and in the first few years of practice. It wasn't until the late 60s, mid to late 60s, that there were immunizations for these 3 viral infections. Measles was a very serious infection. You would see infants with a very flushed face and often running high fevers, and they'd have watery, discharging eyes. They'd often have a cough, and pneumonia, and ear infections were common complications of measles, of the regular measles. Sometimes the measles virus would get into the nervous system and could cause an encephalitis or a meningitis if it got into the spinal cord. And it was a very, very serious infection. And I must say that I have not seen a case of measles in infancy and childhood for probably the past 10 or 15 years. We've seen it in some college-age groups. I think now we do give a booster, and there's a bit of varied opinion on when the booster should be given, the second measles shot. Some people say 4 to 6 years, and some say after 10, between 10 and 14. I've been giving it after 10, like before starting middle school or junior high. And that will give, hopefully, lifelong immunity. What was found was that the infant MMR, the one given at 15 months, did not produce a lifelong immunity. The immunity seemed to run out, and the child, adolescent, became susceptible again. So we give the MMR at 15 months now. The mumps also seems to be very, very effective and very, very protective, the mumps vaccine. I haven't seen a case of mumps again in 10 or 15 years, and I certainly, when I started practice in the late 60s, saw a number of cases of mumps, and it again was sometimes a very mild illness with just some swelling,